continue to do what it's doing.
And I'm here representing the Chickasaw Neighborhood Federation. And on behalf of the Federation and the residents of the Chickasaw neighborhood and the greater Louisville, we report you to reject this proposal. As I listened to the presentation by the company, I just did not get any reason why this proposal is necessary. They asked me for it, but I didn't get a reason why, nor do I get any processes or new technologies that would support this proposal. And for that, we consider the quality of life of the residents in the area about these fence line neighborhoods, Chickasaw neighborhood, that directly lines with Brooklyn County area. And our quality of life is directly impacted. We ask, in this great city that we say we live, to work, to worship, you can play, and we ask, can we do the same in this great city? Can we work? It's concerned not just the residents, but the workers, but the risk of the workers. We have to make that consideration. The quality of life, and we go out and play and enjoy our homes during this increasing mission. As we said, that this is just not this one chemical that's being emitted from this company, but it's a cocktail of chemicals, not only for this company, but there are other companies. And what are the other health risks that this increase will have on us? And not just 70 years, what about 5 years, 10 years or something? It's definitely not directly impacting our lives. But this increase, this doesn't seem to be justifiable in any way. It doesn't seem to be beneficial in any way, definitely to the community. It seems only to be maybe for profit for the company, and the quality of our lives is not worth any of the profit of the shareholders' interest in this particular decision. And so therefore, we ask you to vehemently reject this particular proposal. Thank you.
I don't know where to start at, but I worked at Rough Town. So Rough Town is more than one company. So the other companies, I don't know how many use beauty dining, but if there are, and they're making their emissions, I don't know why they can't make their emissions. So by working over, it's all a business. And if the man can't keep up, he got to get out. Right. So you can't be asking the people to suck up more of this so they can make money. Right. All y'all live in the area where y'all wouldn't want to be close to this. We close to this, we got to live with it. I made a living over there. But when he's talking about testing something 4 times a year, that should be tested every shift. That's right. So he ain't did nothing, but he had a camera and make big money. But you need more help. If you can't find your emissions came down and then they go back up, something's going on. You can ask other people around you who use butadiene, how did y'all get y'all level? Okay? So there ain't no sense in going back up. That's your fault, and you ain't put enough money from going from what I seen that every quarter. Somebody all they got is a machine sniffing flames. Ain't nothing to it. The machine's doing the work. So that's for somebody that don't work over there. It's a good picture. That's all. So I think if you can't play into, old saying, if you can't run with the big dog, get back on the porch.
Thank you.
Carolyn Embry. Good morning. My name is Carolyn Embry, and I'm speaking this morning as a private citizen. But I recently retired from a 30-plus year career with the American Lung Association, and I was a member of this board at the time the STAR program was originally passed, unanimously passed, after an exhaustive public participation process, the most comprehensive, prolonged process of evaluation that I was ever involved in my 30-year career. My remarks are predicated on the belief that everyone has a right to breathe air that is clean and healthful, and conversely, that no one's health should be impaired by the air that they breathe in their ambient environment. I'm strongly opposed to the district's proposed relaxation of risk goals applicable to American synthetic rubber for toxic chemicals on both industrial and non-industrial properties. The fact that ASRC has made tremendous strides in the reduction of their toxic emissions is noteworthy, but the company's use of best available control technology does not necessarily preclude the availability of other control measures that could be applied to reduce their emissions. In the years since the passage of STAR, there have been a number of revisions to make adjustments that provide clarity for the regulated community and modifications for ASRC. The proposed changes currently being proffered by the district, however, would go much further and would weaken basic health protections, resulting in an unacceptable increase in deaths, a consequence which is simply untenable. The increased health risks for Rubbertown residents and for industrial plant employees on the grounds of their company must not be tolerated in a community that consistently fares poorly in national health rankings and is among the top U.S. cities in rankings for industrial toxic air emissions. The proposed weakening of regulations would be a slippery slope that would increase risk, give unfair advantage to one company, and likely open the floodgates of requests from other members of the regulated community for similar relief. I urge you to pull this proposed regulation modification and reject any further weakening of the STAR program. Thank you for your consideration.
Our community is important as any other community, and I'm really just fed up with really my friends from other communities coming to my home, and that smell. I know that's not totally all your fault, but it's just embarrassing. We have so many other things that we have to worry about, crime, et cetera, et cetera. This is just another thing, and I don't want to break down my property value because of this too. And I'm tired of people being sick, not being able to breathe. I don't want my kids and my grandkids come over to visit. I don't want to be thinking about my kids dying, over in my beautiful neighborhood because somebody doesn't give a, what about our people. So all I'm saying to you is, we have a wonderful community. We still need help. And I don't care, it's a beautiful PowerPoint. I can make them too. But there's no reason why you can't fix whatever your problem is. Fix it. Don't expect us to suffer for it. And that's all I have to say.
Basically speaking as a resident of District 1. I I live in the Park Duval area. I purchased my home there in 2000. My daughter was born in 2003. And she suffered from asthma, respiratory infections, chronic asthma for several years and still has it. I'm very concerned and I guess fed up, just like the young lady just stated, with the emissions that are being put out in the air in my neighborhood. Particularly last year, I started to do some research. I made a visit here to speak with Matt King to talk about how bad it was in my neighborhood and the fact that the smell was coming into my home. So I couldn't get away from it. If we stayed in the house, we smelled it. If we went outside, we smelled it. There was nothing I could do to get rid of the smell. So I came here and I sat down with Mr. King and I spoke with him for 45 minutes. I requested an open records request regarding the violations with your company, okay? And first of all, let me go back and say that I oppose totally to reducing any restrictions on the company because the level of violations that they have received is astronomical as far as I'm concerned. I received 20 PDF files, so much information that I have not even been able to review all of it. But you all have that information, okay? I've even gone back and found that there was a West Louisville air toxic study risk assessment done that was given to this office as well back in 2006 that clearly details that the emissions are toxic and how they refer to increasing the risk of cancer. So although you have made some strides since 2003, I've been in the neighborhood for 16 years, and between August and November of last year, it was unbearable. There was something going on over there at your plant, something was broken. I don't know what was going on. Violations were coming in by the dozens into this office and complaints were filed. Mine, of course, was one of them. So you cannot allow them to continue to emit these emissions in our neighborhood. I want to stay here, but I'm really considering if I need to leave. And I don't want to do that because I'm a taxpayer. I'm clearly here today. I work every day, and I work in my home. So I don't get to go away to go to work and then come back to my neighborhood. I'm always at home, generally because I work there. So I will continue to be involved in these meetings and show up and speak regarding this because I'm concerned about my health, I'm concerned about my daughter's health, and I'm concerned about every resident in District 1, 3, and 5 that is affected by these emissions. Thank you very much.
If y'all are familiar with the work that the Center for Health Equity or the work that the Public Health Department is able to do, but one of the recommendations that we advocate for at the Health Department is that comprehensive policy is the best policy, and that any exemptions may create confusion or impact negatively the outcomes that were designed for that policy. Additionally, particularly for my colleagues over at APCB, I know that we work in silos often. It's very difficult to know all of the resources that are available through all of the 26 metro agencies, but at the Public Health Department, particularly for those who have questions about the health impacts of this potential policy, we actually have a resource, a health impact assessment person in our department who can conduct rapid assessments or long-term assessments and can identify or can answer some of the questions that people in this audience have. Additionally, we have a racial equity assessment that can be used as well. So I would just encourage you, particularly my colleagues at APCB, to please contact me and we can have a discussion about how we can get those assessments rolling for you all. Thank you.
plumes from Town do make their way to other neighborhoods, so we're all concerned about this. But I just am going to highlight some points of confusion that I have based on the presentation today, mostly about data that was not presented. Excuse me, there was an image, a table in the presentation about how often emissions were tested, what equipment was tested for emissions, and at what time periods. What was not presented was data on which of these, what equipment was most likely to emit fugitive emissions, which I'm very interested in. I'm also interested in how this is about the claim that they're using best available technology. I attended a meeting that was hosted by REACT a few months ago where representatives from the EPA were present, as well as representatives from ADCB. And there was a lot of talk about the upcoming continuous monitoring that the EPA will be requiring. And I'm not sure why we're saying that this company is using best available technology when continuous monitoring is available. So that's a point of confusion for me. I don't believe that enough information has been presented by ASRC to support their claim that they're using best available technology or best practices with the technology that they have.
Sure, I was just about to say, is anyone else?
My name is Bonnie Hines Hudson. I'm a District 5 resident and very supportive of all the efforts that the community puts into environmental justice issues, and wondering why we have to keep coming back to the table to beg for basic health and always fight against corporations that put profits over people in a city that at this very moment is convening folks about compassion. There's some contradictions about that, and I don't know if they emanate from having a businessman as a mayor, because business and compassion generally don't go well together. And I'm hoping that by having all of these people come and speak so passionately yet again about how we want to be able to breathe, how we want to be able to live without the threat of cancer. I'm wondering how many of you all live in the West End on this panel. Are there any of you that do? You got one person? You got one person. And I'm hoping that you are tired of hearing us beg for what you don't have to.
Does anyone else wish to answer? Okay.
Thank you. I'm not here to advocate for a position. I just want to add a little bit of clarity to the discussion. My name is Corrine Greenberg. I was one of the stakeholders at the table when the initial STAR program was developed. I was appointed by Director Anderson to the STAR Implementation Advisory Group shortly after its implementation. And there are so many numbers that so many people have seen and discussed and talked about. And I just want to share a little bit about what some of those numbers might mean. First and foremost, I don't believe that the company is asking for the regulation to be modified or revised or changed. The company is asking for the TVAC that they propose for their fugitive emissions to be accepted by the board as appropriate, as allowed by the regulation itself. The regulation says if you can meet these available technology to do the best that can be done to reduce those goals, those emissions as much as they can. That's what's being asked of the board right here. The EA goals on the slide deck, the 1, the 7.5, the 10, the 75. We also saw 96, a 1.93, and 4 point something. What all does add to? Those numbers, the environmental acceptability goals, represent what the board and the district have deemed to be an allowable level of risk associated with stationary sources in our community. So the 1 represents a risk of 1 in a million as modeled based on levels of emissions run through meteorological modeling and distance modeling, proximity to receptors and all that over a 70-year point source exposure. So the recipient of the risk of 1 in a million would have to be at that model location 24/7 for 70 years. What the company is asking for a variance is that if they impose these best available technologies, that 1 might be allowed to go to 1.93. I just want to show, based on the discussions we had in 2004, 2005, 2006, 2007, that at the same time that the Air Pollution Control District was developing their STAR standards, Kentucky Division of Air Quality was looking at the same process. And at one of the DAQ meetings in Frankfurt, they brought up technical experts from US EPA. And at the time, US EPA experts were willing to discuss acceptable ranges of risk from 1 × 10 to the -6 to 1 × 10 to the -4. What that means in real numbers was that the US EPA, depending on circumstances and situations, was looking at an acceptable risk anywhere from 1 in a million to 100 in a million. The Air District held firm and fast to the 1 in a million, and that's the number that is written in the regs here today. So the company is really just asking within the existing reg, without modifying the reg, to accept their best available technology as what can be done for the future of emissions. When we're talking about control devices, if you have a process that is making this thing, reacting this thing, running this line, and you can put a control device, perhaps the best control device is a thermal oxidizer, perhaps it's a flare, perhaps it's a bag house, perhaps it's some sort of filter. That's something that we all do day in, day out in the course of regulating these facilities. The source of emissions that ASRC is bringing before the board are fugitive emissions. And we saw the flanges and the valves and the connectors. And I don't think it's practical or realistic to suggest that they can't have flanges or valves or connectors. The HON rule said, thou shalt inspect these this often to make sure they're not leaking. And then the company had a board order that said, we're going to inspect it this much more often to detect leaks before they're a problem. And now they're coming back again saying, we're going to inspect these valves and flanges and connectors even this much more often, so that if there is a leak, we can detect it quicker and address it quicker. The numbers that the company put on the bar graph, stepping down from 2003 to 2016, those are bar graphs representing actual emissions in pounds or tons. That's different from modeled risk. Because remember, modeled risk is going to take into effect meteorology and proximity to the source. The company did drastically reduce its emissions over time, and their fugitive emissions were pretty much about the same ballpark across the board. And where they're at now, they presented numbers that showed that if they applied TVAC that they proposed, the increased monitoring frequency, it may help them to further reduce the emissions from where they are. And finally, in my last point, just to add some clarity to the concern and question about, does OSHA monitor your plant? Do you wear respirators? OSHA regulates all this entirely different, they measure things in terms of concentration in the atmosphere, parts per million. And so where the company was looking for a variance at its industrial neighboring properties, to go from an allowable risk of 10 in a million to a model allowable risk of 96 in a million, that's under the jurisdiction of the Air District. That's a number that the Air District established and is enforcing through the STAR program. OSHA is already protecting the employees on the ASRC property to a level of 8-hour time-weighted permissible exposure limit of 1 in a million. 1 part per million. That's an actual concentration in air, not a risk. And they're regulating and protecting the employees on neighboring industrial properties also to 1 part per million in air. And my very, very, very last remark is, I really don't think this is opening the floodgates, because I don't think any other company in the city wants to be up here having to make this presentation, certainly not anytime soon. Thank you.
Ma'am, I want to say thank you for clarifying that.
Thank you for allowing me to go.
My question is, would you accept an increase in TVAC in any form if you lived in that neighborhood?
Would I accept an increase in TVAC?
Yes, ma'am.
I do spend a full quarter of my time.
Yes or no?
I would. I would look at the circumstances and what is available, and the best available is maybe what's best available. I don't work at ASRC. I do not know the specifics of this TVAC, but I do know that it was built into the STAR program at the front end to allow consideration of TVAC where the actual model risk numbers don't meet the standards outright. So that was part of the framework.
Thank you.
Thank you. Any more? Yeah. One. Okay.
Hello. Thank you for, sorry. I just want to say that we don't need the modification. I've got a 4-year-old and he's got respiratory issues. I grew up in the West End. We've lost people. We just don't need it. I know she was clarifying things from 2005. This is 2017. Over a period of time, all things change. We don't need it. Just, please take the people into consideration. This is a good day and time. We just don't need it. Thank you.
I do want to mention that the regulatory provisions that the ASRC is applying with their request for modification may be found in ABCD Regulation 5.21 in Section 5 of that regulation. It's available on our website. If people have difficulty finding that regulation, or have other questions about how the STAR program works, by all means, please call our office. We'll find some time to look through, locating more information on the regulatory program itself. We are not revising the regulation. We are taking comment on ASRC's request for modification, and we thank everyone for being here today to share their thoughts and comments with us.
Let me ask if there are any questions from board members.
Just one more.
Okay.
Hello, my name is David Snarden. I'm pastor in the Russell neighborhood. I live in the Chickasaw neighborhood. I was born and raised in that community. I'm 44, so I've been there just about my whole life. I'm going to speak on this from more of a moral point of view, and that legislation and policy speaks to values. And the conversation that we're having today is a value conversation about people's lives and not just about numbers and what is acceptable when you're dealing with chemicals that are getting into our environment, and we're talking about what is acceptable for foreign entities to be in our communities that are taking people's lives, dealing with health complications, with people that are the most vulnerable in our city. This is not acceptable. And to listen to conversations about what is acceptable when we're dealing with the most vulnerable, we're talking about people that may not have the ability to move out of their situation. This is not all a volunteer thing. We have to live in these communities, and some of us like our communities. So to talk about these emissions as being acceptable really speaks to the value of life that we're dealing with in this community. This is also not just a dollar and cents conversation, but this is a value conversation. It is a moral conversation, and I pray that this weighs upon you, because if you had these choices of where you would live, and they're not just theoretical choices, there are real life choices, I believe it would change the conversation about what you would want and accept in your own community. Thank you.
I'm now going to ask, are there any questions by board members? I would like to reiterate that the district has reopened the public comment period, and that there will be a second public hearing, and it will be in the evening at 6 p.m. I think on the 19th of May or on the 17th of May. So there will be here another public hearing. I think this has been a very good public hearing. It's long, but very good. And welcome you to the second one if you have further comments. There being no further statements or questions, this public hearing is adjourned.
When will we know the results of all of this?
After the last public hearing, and an opportunity for the answer to comment now, I expect all of you will stay for our regular board meeting. However, if you're not interested to, we're going to pause here for a moment to allow those who might wish to be excused to do so.
Can I have your name, how it's spelled? How your name is spelled?
Carolyn